Let's jump in. I think one of the things that I've talked to both of you about is kind of some of the common misconceptions around bad breath. So, Dr. Tom, I'm going to start with you. What's the spectrum on bad breath, and when would it make sense for people to obviously visit you guys versus not?
Well, there's two aspects of that question. One is be aware of the tremendous myths that are out there about bad breath. People think that bad breath comes from the stomach. No. They think it comes from the sinuses. No. They think many mouthwashes will help it. No. They think just brushing and flossing will help it. No. So there's a lot of myths out there about bad breath, right? And then, well, how will they know if they have bad breath? So that's a critical question. One is ask a significant other, do you have bad breath? And just ask them to tell you. Also, you can also lick the back of your hand and smell it, or you can scrape your tongue with a tongue scraper or a spoon and smell it, and you'll see if you have bad breath.
Yeah.
Mark, from your vantage point, what have you seen in terms of patients that have come in, percentage-wise to those that maybe think they have bad breath versus it being a real problem that needs some sort of solution that you guys provide?
I mean, we do see some people that think they have bad breath, but sometimes they don't. But there's a good percentage of people out there that legitimately do have bad breath. And, if you've got someone that you trust that tells you, hey, you know what, maybe your breath smells, they actually tell you about it, then that's kind of third party verification that helps us figure out, is it a legitimate concern? Or is it something that maybe it's something else socially that maybe makes you think you have bad breath? But luckily we've got ways to tell empirically, do you have bad breath or do you not? And honestly, that's the greatest thing, because if you're concerned about it, come in, get checked. I mean, we can tell you scientifically, do you have bad breath or do you not have bad breath? So that'll at least put your mind at ease. If you think you do and you don't, good, that's great. If you think you do and you actually do, then we can treat it. And that's honestly a benefit. And, there aren't a whole lot of people that are able to actually treat bad breath successfully. And, we've been able to kind of use new techniques that are far and away better than what we used to be able to even use, and it's very, very successful, and it's great to be able to actually cure people of their bad breath.
So we feel so confident about our treatment that we guarantee a cure or people get their money back. So we can cure it virtually every time. And the thing that we have that's unique, almost nobody has, we have this gas chromatograph that comes from Japan. That's an expensive machine that measures the three main gases that cause bad breath: hydrogen sulfide, methylmercaptan, and dimethyl sulfide. All right, so hydrogen sulfide smells like rotten eggs, methylmercaptan smells like feces, and dimethyl sulfide smells like rotten cabbage. So we get a printout of exactly, this is somebody who had bad breath, severe bad breath, right? So we could get this printout and shows exactly in parts per billion how much bad breath you have. For example, hydrogen sulfide, anything over 112 parts per billion, people can smell. All right, and here's the same patient that we, after treatment, that all the they're well below the threshold level that people can smell. So that's what we see routinely. So we have scientific ways of doing this.